If you're a new parent, every little sneeze, every tiny hiccup, it can all feel like a massive deal. So today, we're going to tackle one of those things that can really cause some worry. It's called neonatal acrocyanosis, and hopefully, we can turn that concern into some real, confident understanding.
So let's just cut to the chase. This is the question that can send a jolt of pure panic through you. You look down at your brand new, perfect little baby, and you see it. Their tiny hands, their little feet, they have this bluish tint. And your mind just races, right? Are they okay? Are they getting enough oxygen? It's a totally normal thing to worry about, and we're going to clear it all up right now.
That moment when you first see that unexpected color, yeah, a lot of parents call that the blue baby scare. It's your protective instincts kicking into high gear, and that's a good thing. But here's the good news. In the vast majority of cases, this is a completely normal, totally temporary part of being a newborn.
Okay, so the official medical term for this is acrocyanosis. But I want you to focus on two words in that definition: harmless and temporary. Seriously, let those sink in. This isn't a disease or something to fear. It's actually a sign, a little story about how your baby's body is cleverly adjusting to this big new world. Now, you're most likely going to see this in the first 24 to 48 hours of your baby's life. It can pop up a little later too, if they get a bit chilly. But it's super common right after they're born.
So, let's just reframe this whole thing. This is not a sign that something is wrong. Actually, it's a sign that your baby's body is working just like it's supposed to. It's making smart decisions as it gets used to life outside of that warm, cozy womb it's called home for 9 months. Okay, so let's dive into the why, because what's happening here is actually pretty brilliant. This isn't a system failure. Think of it more like a built-in feature, not a bug, in your newborn's operating system. You got to remember, a newborn's circulatory system is brand new. It's still learning the ropes. So when your baby feels the much cooler air of the outside world, their body makes this very smart executive decision. It says, okay, priority 1. It temporarily narrows the blood vessels in the hands and feet, the periphery, to send all that warm, oxygen-rich blood to the most important places: the brain, the heart, the kidneys. It's all about protecting the vital organs. The fancy term for this, by the way, is peripheral vasoconstriction. And this right here is the absolute key takeaway. This is not a breathing problem. Your baby is getting plenty of oxygen. Their body is just being incredibly smart and efficient about where it sends that precious cargo first.
All right, this next part is maybe the most important section of this whole explainer. Because what we want is for you to feel completely empowered to know the difference between this very normal thing and a situation that would need urgent medical attention.
And this table really lays it all out. With a normal, harmless acrocyanosis, the blueness is just on the outside, the hands, the feet. But with something called central cyanosis, and this is the urgent one, the blueness is in the core of the body, the tongue, the lips. So the check is super simple. Here's your mantra: are they pink in the middle? If their little torso, their tongue, and their lips are all nice and pink, you're almost certainly just looking at harmless acrocyanosis. So, you've done the check, you've confirmed they're pink in the middle. What do you do? Well, the action plan is incredibly simple and reassuring, and it puts you right back in control.
For normal acrocyanosis, the fix is usually so easy. Just swaddle them up in a warm blanket, or even better, do some skin-to-skin contact. That gentle warmth is often all it takes for those tiny blood vessels to open back up, and for their little hands and feet to turn pink again. And while you're snuggling them, just do that quick check again. Torso, lips, tongue, all good and pink? Great.
Now, these are the signs that mean you need to call your doctor or get help right away. No hesitation. If the blueness is on the lips or tongue, if it's not getting better even after you warm your baby up, or if it's happening along with trouble breathing, being extra sleepy, or not wanting to eat, that's when you need to get a professional evaluation immediately.
But for the huge majority of parents who see this one little phrase says it all: pink in the middle, blue on the ends. It's not a symptom of an illness. It's a sign of a healthy, clever little body making that incredible journey from the womb to the world. It is literally a sign of adaptation.
So, the next time you see something that makes your heart skip a beat, just take a breath. It's a good reminder that newborns, well, they play by their own set of rules. And learning those rules is one of the first and most empowering steps on this whole parenting journey. Which leaves us with a final thought. What other things that seem scary about newborns are actually just a normal part of their amazing development?